Good morning. Good morning, Secretary Sebelius, Mr. Chad Griffin, President of the Human Rights Campaign, ladies and gentlemen of the healthcare leadership of the District of Columbia, honored guests, faculty, and staff. My name is Dr. Frederick, and as the Howard University Provost and Chief Academic Officer, it is my sincere pleasure to welcome you to Howard University on this special occasion. Howard University is honored to host the announcement of the 2012 Health Equity Index Survey. We applaud the work of the Human Rights Campaign because we share your commitment to healthcare equality, and Howard University Hospital is honored to be recognized as a leader in lesbian, gay, bisexual, and transgender healthcare equality. Patient-centered care is the universal standard that is expected of all healthcare providers and healthcare institutions. It is a standard that is deserved by all people regardless of race, nationality, gender, sexual orientation, or gender identity. Howard University Health Sciences is committed to improving patient-centered care by ensuring each and every patient's right to choose their healthcare decision maker and removing all barriers to equal access to quality healthcare. It is imperative that all healthcare facilities train their staff, nurses, physicians, and other healthcare professionals to provide equitable treatment and service to all patients and their families. The Human Rights Campaign has been instrumental in the advancement of the nation's commitment to lesbian, gay, bisexual, and transgender healthcare equality and inclusion. The 2012 Health Equality Index will serve as a powerful tool in advancing this effort. We appreciate the Human Rights Campaign's role as a leader in promoting equality in healthcare. As a healthcare leader, Howard University Hospital appreciates your leadership in ensuring the healthcare industry is informed of the best practices and held accountable for ensuring cultural sensitivity and cultural competence in the delivery of healthcare. Howard University Hospital is proud to be a lesbian, gay, bisexual, and transgender healthcare equality provider. Despite the growth in healthcare expenditures and resources, advancements in healthcare, and the extraordinary developments in healthcare technology, equal access remains a barrier to quality healthcare for many patients in the United States. As long as healthcare disparate treatment remains, there is more work to be done. We will continue to work with you and the broader community to improve the cultural competence of each and everyone that works at this institution as we strive to provide equitable, quality health care for all our patients. So it is my great pleasure to introduce to you Mr. Chad Griffin, President of the Human Rights Campaign. Thank you.
Thank you, Dr. Frederick. You lead by example here at Howard University, and we thank you for your commitment to equality and for your hospitality in hosting us here today. I'm honored to be at Howard during what is my first full week in Washington, D.C. as the President of the Human Rights Campaign. Howard University Hospital and the other healthcare facilities represented here today have earned the distinction of being a leader in LGBT healthcare equality by achieving a perfect score on the Healthcare Equality Index. Now in its fifth year, the HEI rates healthcare facilities on specific criteria that measure equality and inclusion for LGBT patients, their families, and healthcare facility employees. At no time are we more vulnerable than when we're lying on an emergency room gurney or in a hospital bed. It's a scary time, not a time to be alone, and we desperately need our loved ones by our side. And of course, that's exactly where they want to be, not sitting in a waiting room feeling scared or helpless, or even worse, in a car racing home to find legal papers that prove our relationships while critical medical decisions are being made without us. During these very times, a whole host of issues present themselves for LGBT patients and their families. One's sexual orientation or gender identity should never affect the medical care they receive. That's why HRC created the Healthcare Equality Index. This year, the HEI rated a record 407 facilities, with 234 of them, nearly 60%, receiving a perfect score. Yet we have a long way to go to achieve full healthcare equality in this country. For example, a good number of healthcare facilities in this country still do not have written policies that expressly prohibit discrimination on the basis of sexual orientation or gender identity in spite of the Joint Commission standard. A good number of healthcare facilities still do not have written policies that articulate hospital visitation for same-sex couples and same-sex parents in spite of the President's directive. And a good number of healthcare facilities still do not provide training to their key staff members on LGBT patient-centered care. In fact, there are currently 18 states not represented in the HEI. 18 states where no healthcare facility has publicly committed to LGBT equality and inclusion. This must change, and HRC is committed to doing just that. That's why HRC's work is so critical. We know from 2 major studies that have come out recently that there are tremendous disparities between LGBT people and their straight counterparts. The reason for that is pretty straightforward. Concern that we will be judged or discriminated against in a healthcare setting. LGBT people don't seek care, even when they should, at the same rates as straight people, simply because they're afraid. This year, for the first time, the HEI required all facilities seeking leader status to document that high-level managers in key work areas had received expert training in LGBT health needs, and HRC offered this training free of charge. We are delighted to say that as a result, we provided in-depth training to over 1,000 healthcare administrators across this country, an enormous expansion of LGBT knowledge within the healthcare industry. The HEI has proven itself to be a vital resource for every healthcare facility seeking to provide quality healthcare to all of our citizens. The HEI has also helped countless LGBT patients find quality healthcare, free of prejudice and free of discrimination. But none of this could happen without allies like Health and Human Services Secretary Kathleen Sebelius. Under Secretary Sebelius' leadership, the Department of Health and Human Services has taken major steps to better understand and address the unique healthcare needs of LGBT Americans. As a result of President Obama's groundbreaking directive on hospital visitation, she has overseen the creation of those rules. During her tenure, HHS has committed significant resources to LGBT issues, including the creation of the first ever resource centers for LGBT older adults, grant programs to help LGBT foster youth, and improving care for LGBT people in community health centers. HHS has also committed to better understanding LGBT health needs today and in the future through commissioning an historic report on LGBT health from the Institute of Medicine and committing to the collection of health data in sexual orientation and gender identity in federal surveys and programs. Secretary Sebelius cares deeply about the health and well-being of all Americans, and she is a true friend to our community. It is my honor and great pleasure to introduce to you the Secretary of Health and Human Services, Kathleen Sebelius.
Well, thank you, Chad, and I'm delighted to have a chance to join you and Dr. Frederick at this very important announcement today. I want to thank Dr. Frederick for not only his warm hospitality, but his leadership here at Howard in the health services area. Howard is, I just said to him, if you're getting a grade of excellent, it's hard to do better than that. So I like being here with a great health leader. And Chad has taken a critically important role as leader of the Human Rights Campaign, and I just look forward to continuing our work together. You know, for over 32 years, the Human Rights Campaign has been an incredibly powerful voice for many who couldn't speak for themselves. You've raised your voices for fairness and equality for LGBT Americans in the workplace, in the armed services, and now in our country's healthcare system. And when we find ourselves, as Chad said, in a healthcare setting, we're often at our most vulnerable. It's in these moments that being treated with dignity and being close to loved ones can be the most important. So the Healthcare Equality Index is an important tool for making sure that LGBT individuals and families are treated with the same respect and care in these situations as everyone wants to be treated. It shines a light on what our country's health institutions are doing to better serve their LGBT patients. And it's encouraging, certainly, to see more institutions being recognized as leaders in LGBT healthcare equality. So I want to commend, first of all, the Human Rights Campaign and the LGBT and healthcare communities for the progress being made. And I am proud to be part of an administration that has an historic record of accomplishment for the LGBT community and the head of a department who has played a key role in these efforts. But I can assure you that we are going to follow up on that other 40%. We have a few little tools that we can use in our toolkit to get their attention. In 2010, we released a hospital visitation rule, first time ever, to let hospital patients be with their families in time of need, however those families are formed. And that was just the beginning. Today, LGBT Americans face numerous barriers to health, from providers who just don't understand their unique health needs, to difficulty getting health insurance because they can't get coverage through a partner or a spouse. And unfortunately, throughout our country, still way too many LGBT individuals face discrimination and bigotry in the healthcare system. So in the last 3 years, our department has tried to take some concrete steps to knock down those barriers to LGBT healthcare. And they've ranged from improved research on the LGBT health landscape to creating programs to train providers on how to care for LGBT individuals. Later today, we'll be releasing our first version of what will be an annual review of our progress at HHS toward improving LGBT health. And our report shows that we not only met the goals that we set internally last year, but went even further to improve LGBT access to care and coverage. Our report also sets a series of new goals. This is a work in progress, continuous progress. New goals for next year that set the bar higher and push the department even farther toward LGBT health equality. And I want to recognize that in our department, we have some spectacular LGBT health leaders who are leading key agencies in the department, and they have played such a critical role in not only carrying out the President's directive, but in really assessing all of our programs to look at ways we can do better. Now, a lot of these improvements don't get the biggest press headlines, but they reflect how every day, in dozens of small ways, every agency and division in our department is working to make things better for the LGBT individuals and families we serve. So again, I want to thank the Human Rights Campaign for their leadership, for their partnership, and their support in improving LGBT health. The Healthcare Equality Index shows we've made progress, but that other 40% means that we have a long way to go. So thank you very much, and I'd like to turn it back over to Dr. Frederick.